Assalamualaikum and a very good evening to Encik Adli. My name is Faezah binti Manjais. So today I'm going to present on the movement impairment and motor control presentation. The topic that I've choose is on the attentional focus in drop jump activities after SCLR to prevent altered hip and knee dynamic. So within the scope of presentation, I'll be covering on the introduction and what is the attentional focus, motor control impairment and rehabilitation exercises, activities and its reasoning, and some conclusion. As for the introduction, so primary anterior cruciate ligament, ACL, injury prevention have been shown to reduce injury. So recent finding, they've shown that 20% of recurrent of injury happen only after first year following return to sport for this patient with ACLR. So investigation need to be done on how we can actually optimize this problem because it shows a high rate of re-injury. So one of the potential limitation of current rehabilitation that they've looked is on the deficiency in transition from a conscious awareness achieved during rehabilitation to comply the demand of sporting activities. So to explain, so basically some of the rehabilitation exercises that been done doesn't able to meet the demand of the sporting activities. So for example, in high performance athlete, if they are a hockey player, they need to have a good transition throughout from beginning of the rehabilitation days towards until they actually able to return to the sports. So one of it is by using these learning strategies, we call it internally directed focus or externally focused rehabilitation, which has been shown to be more efficient in externally focused rehabilitation. So this new insight gain improved in the neuromuscular training programs, which it can actually increase retention from the improved techniques that they're going to gain. So thus will actually reduce the incidence of having this second ACL injury. So what is actually attentional focus? So attentional focus has been given into two. It's actually internal and also external. So in internal, there will be a feedback direct towards the body movement. For example, if I'm teaching a patient with post ACL, during gait training, we will be focusing, focus on the leg, on the stance phase. So that kind of cue that will be given. But in external, patient attention is directed towards the outcome or effect of the movement. For example, if we need to facilitate the knee extension movement, probably in some, depending on the stage, we can actually provide, ask the patient to do some movement, for example, like kicking a ball. So in internal focus, then we might not be able to facilitate the full potential of SCLR. So because one of it is, it's not to say internal is not good, but we're just unable to facilitate to the maximum potential. While in external, there will be a greater movement effectiveness in terms of the accuracy, balance, and efficiency, because these activities will not be focusing on the injured part. Okay, so in internal, increase of core contraction of agonist and antagonist, which causing a freezing, call it freezing, by limiting the degrees of freedom in movement. So basically, in this to explain easy, because focus have been given to the injured part. So depending on patient, so the probably patient in beginning, they are actually afraid of doing some activities because too much focus have been given to the knee. So but in external, it will actually facilitate motor learning more effectively, promotes utilization of unconsciousness or automatic process. So because sometimes in this external, we give some doing the activities by giving some external focus, for example, using a cone, which actually can actually able the patient, we can ask the patient not to focus too much on the knee or post ACL knee. So one of a good thing, evidence shows that external focus resulted in increased time to peak knee angles, which allows for improved shock attenuation. So, provide some videos to explain on these activities Actually, in my slide, I would like to focus on the drop jump activities, but I'm just doing from the beginning, just to show that there will be we call it a transition, a progression of exercises before we can actually start with drop jump. So I'll just start this video and explain while the video run. So for this patient who's having post ACL, I'm just using this patient as to do a demo what I'm going to do, but this is like beginning for 2 legs jump. We can actually ask the patient to jump 2 legs and then landing and see the quality of movement. With some patient, probably they have some altered movement where they actually unable to landing properly, imbalance, it's not like properly land. So these are the things that we need to counter first, probably doing some repeated activities, exercises, then only we can actually progress to from 2 legs to or jump to a box. So by doing this, we actually this activity will keep eccentric loading relatively low because before we can actually start the drop jump. So we can see in the quality of movement, then only we can actually progress. So by doing this is second. Okay, I'll just stop this first. There's one video that I did not take before we can actually progress from 2 legs jumping and landing squat jump just now to jump to into a box. So we can ask the patient to do, we call it broad jumping, to see on the effectiveness jumping and landing if there is any quality, and before we can actually progress to a drop jump activities. Okay, I'll just continue the video. Okay, this video is a drop jump activities that using this how I want to improve this motor control. For example, given a case that this patient is having a problem in to progress from drop jump landing with a low quality of movement. So in real post ACL patient, they will have a fear of doing these drop jump activities. That's why, as I said, they need to go through stages, progress before they can actually do this movement. You can see when we do this, we actually ask patient to focus and try to jump. You are bending your hip and your knee. Make sure your shoulder. That's how we cue the patient to do this facilitation on motor control training. So in another ways of another ways and also a better ways of doing this motor control activities is by using this external focus, where I'm putting a 2 cone there. So I will ask the patient to repeat the same activities and try when he land, he need to try to touch the cone. So there's a difference between just now without a cone and also a cone. So you can see for this patient. So throughout the rehab, we need to ask the patient to focus not during at the jumping hip and knee. Focus will be trying to touch the cone. So there will be, you can see here, right? Again, one more time, ask patient to do. So you need to have recovery in between so that, yep. In rehab, normally we do 3 sets of 10, recovery in between sets like 2 minutes. So you can see there is a difference using and without using the cone, whereby when trying to teach a cone, patient or athlete able to bend more, the knee bending can actually goes more than just now. Right now, I'm asking the patient, is there any difference? So he's telling me that when trying with a cone, he feels that actually focus will be more on the cone, not on the knee itself. All right. Okay. This is the technique that I'm focusing on this presentation actually. Sorry. Okay. So in terms of this movement and cues given, you can see that internal and then external focus, I did explain throughout the video. So for example, in internal focus, instruction given, land with your feet at your shoulder wide, keep your knees over your toes, land with the bend knee, bend your hip and trunk. So these are the cues that have been given during internal focus. But it will be good if we can actually, using this external focus, land on the markers on the floor. Just now you can see we put the 2 box. so that we ask them to land on the markers and point your knees toward the cone, touch the cones with your hands. So this is, we call it the difference between internal and external focus. So I hope by now I'm able to explain details regarding the differences in between internal and external focus. Again, what is attentional focus? From the beginning until the videos and also towards what I've tried to explain regarding this internal and external focus, especially during the drop jump activities. So as the main key thing is based on my experience that I've seen is increase in core contraction. This is like they will give in external, will gain more range compared to internal. So most of the patient with post ACL, they've been fear of doing things, focus so too much on the knee. So by giving this external focus, they will actually forget about the injured knee and try to uh, do the movement without having a worry on the injured part. Okay, so hopefully by implementing internal and external focus, for example, to improve in motor relearning on that on particular patient on post ACL after post ACLR. So these are the thing like in two legs, where we want them to have a better quality of movement from jumping and landing without having this is you can see the knee in internally hip and knee altered hip and knee movement. And after that, after patient is able to do two legs, then only we can actually progress to single leg. And if we fail to deliver good motor control learning, this is what happened for two legs, and this is what's going to happen for single leg. So this is a proper technique on when they should land in this quality of movement, and this is a wrong technique. So as a conclusion, motor control rehabilitation can be optimized by combining the internal and external attentional focus, which may enhance the automatic movement control and performance improvements. So this monitoring basically when it should to be done should be done as a periodic monitoring, even during rehab. When they return, we need to advise patient to monitor, and then if we have a good relationship with coach, for example in coach can actually monitor that, so that if patient is having that, we know that there's some weaknesses that need to be countered, that we need to strengthen. And by doing that, we hope that we can actually prevent this injury in that particular patient who's from having this secondary SLR. With that, thank you very much, Teacher Adli, for this first semester. Hope to see you again second semester, inshallah. Assalamualaikum.